Let's see, who else do we have here? Look at my. Okay, great. All right, I do think, is everybody all getting ready for the holidays? Every day's getting closer. Wonder if we can just kind of get started and everybody will jump in as they come along, because we always have a little bit of a little intro. So let's just do that part. Okay, welcome. And as you know, this is our monthly echo. Oh, hi from Guam. Hi, Margaret. Good to see you. I'm so glad you join us all the time. Yeah, so yeah, from the convenience of your own home, even in Guam, you can join us, right? You can join us from neighbor islands. You can join us from anywhere, right? We learn from each other, learn from experts. We can commiserate, talk about our challenges, and it's free, and you get free education credits. So that's great. Next slide. And just if you want to be sharing and talking about your patients and your residents, do not share their patient names or birthdays. Keep everything safe and confidential. And these are not official doctor consults. These are for teaching purposes. Next slide. And as you know, you have a Zoom chat box at the bottom where you can type your name and the names of others joining today's session with you today. So you can see everybody's doing that already in the chat box. I got 7 people out of 51 who put their names in the chat box. So go ahead, chat away, put in your names and the people with you, just like Jeannie and Maggie. Okay, and of course there's the mute button that makes sure it's on mute when you're not speaking, and of course unmute, because we love to hear from you when it's time to share. Okay, we are on the 3rd Thursday of every month, and today is December 16th, and we are going to be talking about addressing loneliness and depression. And in order to receive certificates of attendance, there is a website, a link that will be put into the chat box towards the end of the session, where you make sure you click on it and you complete the evaluation, and you'll be able to get credits. Next slide. So just a little introduction. Our hub team, that includes me. I'm Dr. Wen, the course director. We have Juanette Gaylord, she's here. President of the
Aloha. Happy holidays, everyone.
Great. And Maribel, have you joined us?
Yes, Dr. Wen. Happy holidays to everyone.
Yay, thank you. And Shane.
Hello, everyone. Pardon me, I'm calling in from my phone, so hopefully you can hear me okay.
Yep, got it. And unfortunately, Juliana from Aloha Care won't be able to join us today. Oh, hi, Shane. Okay, great. All right, so I guess without further ado, we should get going. So we're going to start off with some COVID updates. Okay, so here we are. Where are we right now? So we are the blue line over here. We did really, really well, squashed this thing. We had a big surge right back in September, and we kind of got back down. But you know what? We have the Omicron variant that's kind of hitting the US right now. And the cases are just spiking all over the US. And so the US and Vermont are pretty high. And so far we're here, but our cases are starting to go up. So really, we all need to be really, really careful. Next slide. But I just wanted to tell you a little bit more about the Omicron variant. Basically, variants, these are mutations. They're classified, with different names, and, they have different levels of contagiousness and, different properties, how severe they are. But the Delta variant that's been around for quite some time now has been has, I don't know, it's about 97% of all the COVID cases in the US is still the Delta variant. And so if you see people getting sick, most likely it's the Delta because over 97% of people still have that. However, Omicron seems to be moving in very, very quickly. The doubling time is every 2 days. On December the 1st, just 2 weeks ago, there was a first report it detected in the US, and that was in California, and reported in 24 countries. And then December 3rd, it was first detected in Hawaii. And then 2 weeks later, December 14th, Omicron was reported in 77 countries and in 33 states, and is about 3% of the all the COVID infections. So it's moving pretty quickly. Fortunately, so far, it doesn't seem as severe. So far, symptoms appear to be mild. They're like just a cough or congestion and some fatigue. Not a lot of high fevers or shortness of breath or anything like that. So it seems like just a cold. However, we don't really have enough data because it's only 3% of the population getting it. But in South Africa, where not a lot of people are vaccinated, about 29 fewer people are being hospitalized than with the Delta variant. So I think overall it does seem to be less severe. So I guess that's a good thing. Next slide. Okay, so a little bit about Omicron testing. So currently, either the antigen or the PCR test will pick up the COVID, but it cannot tell which variant it is. So in order to figure out which one it is, your COVID test, if it shows a positive, you actually have to get another test, a genome sequencing, in order to determine which variant it is. So the Department of Health will do the genome sequencing. I would say, you know, because it's such a tricky thing, it seems to be in the community already. I would have a very low threshold for testing. You know, even if a person feels like, oh, I'm not really sick, maybe got some those little stuff, please go ahead and get tested, because otherwise you'll wind up spreading it without realizing it. And I would even consider testing before you join indoor gatherings with others not in your household. You know, you can't make anybody, but you know, suggesting that people get tested is not a bad thing to do. And what about the vaccine? Well, because the idea is that Omicron has a lot of mutations, and it has like over 30 mutations in the spike protein. And so our current vaccines, therefore, they don't recognize it as easily, and so it's less powerful against the Omicron. But it turns out that the Pfizer full vaccination dose series of 2 gave about 70% protection against hospitalization from Omicron, compared to 90% efficacy for the Delta variant. So 70% is still, most of them, still very good, and that's probably the best we have. So that's why we, CDC is suggesting that everybody gets boosters to help prevent, to help broaden and strengthen the protection against Omicron and the other variants. So yeah, that would be really important to do. Just encourage everyone to get the booster. With regards to treatment, so far as 2 days ago, people have been looking at studies with the monoclonal antibody treatments. And so far, it's not effective against the Omicron variant. But the 2 others, the GlaxoSmithKline and the Vir Labs antibodies, seem to be promising, but they're not in the US. And so that doesn't help us any. So we're kind of back on that one. And then the Pfizer pill antiviral that is suggested to be taken within 3 days is 89% effective in preventing high-risk people from hospitalization and death, but it doesn't separate whether it's Omicron or Delta. So I think so far the best bet, I think, is within the yellow highlight, booster shots for everyone. Strengthen your own protection, your own immune system to get stronger to fight Omicron and other variants. Next slide. Yeah, so here's the bottom line. Wearing a mask at all times, well, mask wearing is not specific, so it protects against all variants no matter what it is. So if you're in, so avoid large gatherings, and if you are in a gathering with people outside of your household, wear a mask, right? Wear a mask. If you know, and I wouldn't go out and eat at restaurants at this time, given the very high infectious rate of this thing. So yeah, get vaccinated and get a booster. You will hopefully prevent infection, or if you do get it, prevent severe infection, slow the spread, so it won't spread so quickly, and reduces the likelihood of new variants popping up. So the more we slow it down, the less variants we're going to get. And then, yeah, get tested, even if you feel even mildly sick. You don't have to have shortness of breath and severe cough. Even if you just have congestion, go get tested. You can do PCR, antigen, or home self-tests. I see that somebody had a question about home testing. Now I cannot find it.
It was me, Dr. Wen. I asked if the home tests are really valid.
Mm-hmm.
Do you feel that they're really actually validated?
You know, the gold standard is the PCR. However, you know, PCR takes, you know, a little longer. And you know, I think with this thing, time is of essence. I mean, you wait one day and you can spread this thing to 20 more people, right? I think just, you know, the fastest test you can get, at least get some preliminary data. Yeah, and then of course, if you're really highly suspicious, then get the PCR. But I think the faster we can catch these things, probably at this point, is probably the way to go. But more accurate, the PCR is the most accurate.
And you see the other question regarding where people might be able to obtain those tests?
No, I have no idea. I don't know why they're not as accessible as they should be. It's a good question for DOH. Yeah. Next slide. Okay, so here's the situation, right, that we are in, right? So just like all the nursing homes, CMS has guidance, which I guess DOH has also adopted the similar, oops, slide, go back, the slide back. Yeah, just go backwards. Yeah, anyway, so the social isolation was, we've seen the problems with social isolation and depression and things like that. So we don't really want to go there again. So CMS said, no, you cannot prohibit, you cannot stop visitors. You have to let them in, regardless of vaccination status. You got to let them visit. So while we cannot stop the friends from visiting and the family from visiting, whether they're vaccinated or not, you know, then, but what can we do? We can take measures to stay safe. So you can sort of see the whole Pooh family out here, right? So you can screen visitors, and you can say, you know what, outdoor visiting, you know, it's not saying you can't visit, but outdoor visiting is, you know, what we recommend here. Wash hands, clean surfaces, wear a mask. This thing is very contagious. I would wear it if I were indoors and outdoors, 6 feet apart if you can. So all the respiratory droplets, you know, don't have a chance to fly very far. And of course, you know, don't visit if you are COVID positive or if you have any signs or symptoms of a cold at all. And one more thing, which we want to encourage you to do, is that, you know, some families I've encountered as well, you know, they refuse to be vaccinated, and they're the same people who also refuse to wear the mask and refuse to, and they refuse to, you know, comply with things like that. You can ask them to leave. If they cannot follow the safety rules, it's okay to ask them to leave. They can stay, but they have to follow safety guidelines. So, and also if they're traveling from outside internationally and whatever, and they don't, you know, they have a test or they are not following guidelines, then, you know, that's not too safe. So I think we have to still do our best. We cannot tell people not to visit, but we can ask them to visit safely. So that's what I'm going to encourage you all to do. This is your home. Next slide. Okay, John, you've been trying to do this next slide for a while. So anyway, so now we're going to be talking about depression, social isolation, loneliness, and depression, and what are we going to do? Okay, so thank you, everyone. I know you've been screening your residents for depression. You've been doing the PHQ-2, and you've been scoring people, and it's really great, and we really appreciate that. And of course, if the score is 3 or more, major depression is likely, and you need to let the doctor know. Next slide. And by way of review also, we appreciate that you tell the doctor, because the doctor can do a bigger evaluation, do a longer test called the PHQ-9. They will also want to review their medical problems and their medical list and ask you for all these other observations, and they can make the diagnosis of whether they think this is depression or, could be a medical illness. Next slide. Okay, and so of course, once you got a diagnosis, right, you got to make sure, well, this guy's not gonna, do suicide. And, we have psychiatry, maybe we're going to start them on antidepressants. The next part, the non-pharmacologic part without drugs, this part is actually the most important part, probably even more important than the doctor or the psychiatrist or the antidepressant. This is the part that's really, really important. I'm going to go through this in more detail. This is the part where you play. Next slide. Okay, so as I said, you create a depression care plan, right? You have depression. Think about, what are the goals we have for this resident? We don't want them to have as many negative comments, and we want to get them out of the room for at least twice a week if they're refusing to get out. Maybe our goal will be to improve that PHQ-2 score by the next quarter. And, make sure we get that medical evaluation, antidepressant, keep everybody safe. And then I have a whole bunch of question marks in there. And this is where the whole team comes in. The whole family comes in and starts brainstorming and thinking about what can we do to help with this part. And then, of course, make sure we evaluate again in 3 months. Next slide. Okay, so this is basic non-pharmacologic approaches. So, just like, if anybody is having a hard time, a gentle and respectful approach is very important, right? Address them as adults, address them with dignity, treat them with dignity and respect. Don't talk down with them, even if you don't mean to. Try to take extra special gentleness with them, and make a connection. Just as we talked about with people with dementia, people with depression, they are withdrawing. They're pulling away from people because they're so depressed. So you have to reach out and make that connection. And the connection is either verbal, where you're speaking to them, visual, where you make eye contact and gentle touch with your hands to make sure that you're really connecting with them. So making a connection is important. And validation, actually hand in hand with that is interactive activities. It's not, if they're depressed, they are, or isolated or lonely, right? They don't want another iPad to look at or another magazine to just look at on their own in their own room, isolated, right? Try to figure out what is an interactive thing we can do. And then validation therapy, which is validate them. If they're feeling bad, acknowledge their feelings. And don't argue, don't judge them, don't say things like, well, you shouldn't feel like that, everybody loves you. Oh, great. No, just acknowledge them, don't argue, and just encourage them and be gentle. So this, is sort of like a best friend's approach, right? So just treating them in a very honorable way. So that's important for all residents, but I think especially important for people with depression. Next slide. Okay, so depression is a vicious cycle. So what does that mean? That means that, so for example, Eeyore's tail, right, keeps coming off, keeps falling off. And that causes him to feel pain, fear, embarrassment. And then because of that, he avoids activities. And then he stays all by his lonesome self and feels sorry for himself. And then he gets isolated and lonely and more depressed. And then because he's so isolated and lonely, he's got nothing in common and doesn't enjoy stuff, he doesn't want to go out, and he has more fear and more embarrassment. And then it kind of goes on to more avoiding activities and goes round and round in a vicious cycle called negative reinforcement, right? So that's the problem. And that's why the answer is something called behavioral activation. So behavioral activation is the way out. This is the medicine. Next slide. So let me describe behavioral activation. It's an outside-in approach. So what happens is that you engage the residents in behaviors to fight the tendencies to be alone and inactive, right? So you just do stuff with them, right? And if you do stuff with them, mood improvement follows, right? And if they feel a little bit better by doing an activity they enjoy, they're more likely to do the activity again. And then if they do the activity and they feel better, then they're more likely to do it again. And so you have this cycle of positive improvement, of positive reinforcement. And yeah, so this is, especially for those, I mean, it works for anybody, but especially for those with depression, with dementia as well, who can't really, reason with you too much, just engage them in activities. And so, yeah, so here's Tigger. He's got the idea down. He says, I have a great idea to cheer Eeyore up, right? And so Pooh is like, yes, let's do it. Great plan. Let's do it next Saturday, for Saturday afternoon. So the idea is, you have to act on it, right? And it's an outside-in approach. You don't wait for them to feel better in order to start joining activities. You do the activities first, and then you trust that mood improvement is going to follow. Next slide. Okay, and so here is another slide here. So here's Tigger, and he says, this great idea I have is to go bouncing, because bouncing makes me happy. It's going to make him happy. It makes everyone happy. It's the answer. It's the solution to everything, which of course, it doesn't really, because Eeyore doesn't like bouncing, right? But instead, Eeyore likes to eat thistles. He likes to go out into the garden in the forest and find thistles to eat. He likes thistles. Pooh doesn't like it so much, but he knows that Eeyore likes it, and so he's willing to do it with him. Right? So it's important to do activities that they like, because if their problem is they're not getting engaged, the only way you're going to get them engaged is by doing stuff that they particularly like. So it has to be person-centered. Next slide. So you have to make a plan, because if you don't make a plan, right, it never happens. So maybe the plan is, okay, here's a specific plan. Go on a thistle hunt with Eeyore, or have a picnic in a thistle patch. So let's plan that. And the thing we're going to monitor is like, okay, let's see if he can get more time out of his gloomy place, less negative comments, less moaning, better sleep, better appetite. We'll look at all those things that indicate that he's feeling depressed and see if all those things hopefully get better. Next slide. So how do we do this? How do we do behavioral activation? So here's the steps. Well, first we have to identify the pleasurable activities, right? It could be in several different categories. So physical activities is one category, social interaction is another, pleasant activities is another. And so we should help the resident choose and schedule a daily pleasant activity. And we have to make a detailed plan, like day. And what time of the day? Is it morning, after breakfast, or after lunch? How long? Is this going to be an hour? And with whom? Who's going to join? Is it, is it this aide, or is it that? Or is the cousin coming, or something, right? Figure out what the barriers are, make sure this plan is realistic, and find ways to overcome any barriers. And then help the resident mentally rehearse the activity. So basically you tell them, hey, they're going to be doing this tomorrow. Oh yeah, tell me, did you used to do this? And what did you like about it? What did you used to do? And kind of talk it up a little bit. And I would even suggest is that consider taking pictures and talk about it afterwards and say, look, I saw you were doing this yesterday, and look, you were smiling, You're having a good time. So just sort of milk it and get the most out of each activity that you do plan. And remember that behavioral activation is all about the behavior and that they don't need to feel like doing it. Okay, because that's what it is. The behavior activates them. The feeling comes later. Next slide. So here is a way to help you. It's an acronym called GRAPES. So GRAPES are just suggestions for the kind of categories of activities to do for people with depression. So be gentle to yourself, be gentle to the resident, right? They're vulnerable. They're in a very vulnerable state. So just be extra gentle. Relaxation, make some time to relax. Maybe a gentle massage, watching fish, feeding birds, something really relaxing for them. And accomplish something. Maybe it's just fold laundry or write that letter to, your sister that you meant to write forever and ever. So accomplish something. Pleasure, do something that gives you pleasure. Listen to good music, taste a sweet fruit, pet an animal, and really think about that pleasure. And exercise helps a lot of people feel better too, even if you don't want to do it initially. So grapes. So I wanted to let you know that this grapes thing, there's a website. And when you go to our website where you registered, we put in a bunch of resources and there is one about grapes. So make sure you take a look at that. Next slide. The other idea for behavioral activation is to create an activity menu. And so this is just some, idea like this is so you make activity menus in categories like animals, like petting an animal, walking a dog, bird watching. Not everything in here is, applicable to our older adults. This is a general activity calendar menu. There's cooking, mind, self-care, music, being creative. There's actually 3 pages of this or something like that. So it's a lot of ideas. So if you're running out of ideas, just take a look at this. It's also in your resources tab in the website. So yeah, take a look at the activity create an activities menu with the resident, with their family, with your team. Next slide. And then make a plan for every day. So the idea is that every day they should have at least one grapes activity, one pleasurable activity each day at least, that they can look forward to and enjoy a little bit each day. So for example, get the nails done, pick flowers, sit in the garden and just listen with them. Listen for birds, listen for dogs barking, listen for children playing, whatever it is. Watch a movie, read some letters from the family, soothing music before bed, visit with a friend. So just make sure, because if you don't put it in the calendar, you're going to leave it up to random chance that any of these things happen. But try to include something that are pleasurable for that resident and include a mix of those activities. Okay, don't forget the grapes. All right, but you've all had grumpy cats, right? They say, no, hey, let's try this. You want to come out? And no, I want to stay in my room. All right, okay. All right, do you want to try walk? No, I want to stay in my room. Okay, right? So sometimes they don't want to. But, like medicine, even though they don't want to, it's important, right? So we can try to start low and go slow. So don't shock them too much. They're kind of used to this being in this sorry state for themselves. So we have to meet them where they're at. We ask them about their reasons that they are reluctant, and then start with the smallest version of a goal. So like, what are they willing to do? If they're not willing to walk 20 minutes, maybe they'll walk 5 minutes. If they're not willing to walk 5 minutes, maybe they'll just walk down the hall. That's it. Or maybe if they don't want to walk at all, just get them to stand, right? Start with the very smallest version of a goal and see if we can do that each day, and then increase it little by little by little each day. And hopefully you'll be able to do a little bit more. You know, if they only tolerate 10 minutes in the activities, that's fine. 10 minutes is good. Yeah. Next week we'll try 15, right? So just keep being persistent. Next slide. Okay, so this is but sometimes, you know, it's even more challenging. They don't say yes very easily, right? It's hard to get them to convince them to do stuff because they're very, very depressed. So sometimes it can be helpful. You have to sort of kickstart the behavioral antidepressant. And so maybe you need to try antidepressants, right? So if you work with the doctor and you get the antidepressants can help you push that rock up that hill just enough so that they can at least begin thinking about activities. Sometimes if you can get a psychologist in, they can also help support the behavioral activation efforts, and they can talk to the resident and, you know, encourage them as well. So some more people encouraging them and, you know, doing that cognitive behavioral therapy. I'll talk about that a little bit in the next slide. But yeah, if you can do a little bit of support, push them up the hill, and then you can implement the behavioral activation. And basically the behavioral activation is the medicine that will ultimately help them overcome the depression and maintain that so they don't continue to slide down. So this behavioral activation is really, really important. That's your medicine, more so than the antidepressant. And that's why it's up to you guys to really, really make the difference. Next slide. Okay, so what is cognitive behavioral therapy? It's basically they meet with a psychologist, and the psychologist helps them think about better ways of coping. You know, they have this challenge that they're really, really unhappy about, and, you know, but you know what? Let's think about it differently. Change the unhelpful ways of thinking and reframe things, and they can think a little bit about their situation in a better way. But usually you require somebody who has more cognitive ability and not as much dementia. So they have to be able to be willing and also able to do that. But sometimes, you know, if that's the situation for your resident, then I would encourage you to use a psychologist or behavioral health specialist for this. I think that's been underused. And certainly you can speak with them and they can give you ideas what to do as well. You know, all the tips that I gave you about the behavioral activation with the grapes and with the calendar and with all that is I learned that from the clinical psychologist. That's what they're going to tell you. That's what they're going to tell the patient, right? These are ways to get out. Okay, next slide. Okay, so creating a depression care plan. Okay, so here we are again, and just want to see, so anybody have had patients like this? And what are some things you found that were helpful? I'm just going to open it up to the chat and see what people say. I know you guys have patients who are depressed. Any things that have been helpful for folks who are really down?
I'm telling you, no matter what, food always makes people happy. So we buy a lot of desserts.
Yes. Do you find people like ice cream?
Absolutely. We're stocked with ice cream. And the sweeter, the better. So, yeah, I've learned how to bake sugar-free cakes also.
Ah, great. Anybody else find ways to do some behavioral activation, something special? They like their coffee and tea time. And I bet you tailor it, right? to the specific tea that they like.
The majority of them like to go sit outside on the lanai also. They always like to get outdoors.
What else have you found help people kind of get out of their rut? Anything? Guys, oh, here, our PT activity folks make activity boxes to their specific interests, right? So it has to be patient-centered, right? Somebody who really likes crossword puzzles, right? Other people hate them, right? Music, movies, calls from family, right? Can you get that scheduled in? The calls from the family, those are probably best scheduled in, right? Do you guys at the care homes have activity calendars?
We do, but you can't always follow the calendars.
Mhm.
There's always seems to be something that comes up, but we do vary the different activities based on level of care, cognicity.
Mhm. Yeah, and you know something, I think the beauty of a care home is that it's smaller than a nursing facility, and therefore it does have the potential to be able to be more person-centered. So in some sense, you know, it's kind of more family-like, and so just paying attention to what they really, really like. And not letting the, you know, everyday crises and routines kind of just drive the day, right? And forget to do something really special for each person. Okay.
And it really doesn't have to be anybody's birthday to have a party. You can always hang balloons and hang banners and just make believe it's somebody's birthday.
It's true. And you know, there's a place that I know that they're like, you know, well, you know, some people are food obsessed, right? So, and you can always find National Chocolate Day, National Cookie Day, National Pancake Day, National Donut Day, National Sushi Day, National, right? There's something. There's always something to celebrate. So people find all these things and they make it make something, right? Special. If they like food. Right. Okay. So now I'm just gonna, just like we want to support the well-being of our residents, we also need to be mindful of supporting ourselves too. And because we're heading into the holidays, I just wanted to throw this one up there. This is another holiday tips for dementia caregivers from Alzheimer's Association. Just as ideas. One, show the person with dementia photos of the guests 1 week before their arrival, because people do come out of town. Arrange phone calls with the person with dementia with visitors before the event, so their voice sounds familiar. Right? This is part of what I talked about a little bit about talking it up, right? About a week in advance, talk it up, have them get excited about it, right? Keep the person's routine as close to normal. And ensure the person with dementia gets enough rest so that they're not overtired and fatigued and get cranky from that. And then, of course, enjoy time with your friends. So being mindful of our dementia residents' needs is good. Other thing I wanted to share is just the social wellness checklist. This is not for your residents, this is for you as you are doing the caregiving every day. So this checklist is actually also in the resource list on our website that I would encourage you to just print it out and share it with your staff and make sure you guys help each other do these things. These are just positive and proactive things to to make connections, and get involved with each other. These are just some ideas that if you haven't done things in a while, do something like a hobby and try something new, try a physical activity with friends, go walking together, something, make an effort to make social connections. It's so easy to just stay isolated. But I think that, even like I said before, right, no social isolation, we can find a way to do it safely so we don't get isolated. Next slide. And part of that, I know we're all busy, so we need to take care of yourself while you're caring for others. So, make sure that you find ways to do that, fit it into your schedule, ask for help, make a list of ways that others can help. If you have a routine, someone else can jump into the routine. Try to schedule in breaks as you can. Support group, eat healthy, and exercise. Easier said than done, but if you can find friends to encourage you and do it with you, you have to take time to take care of your own health and your own body. And then, getting active together. So that means, like I said, like start a walking group with your friends, right? Join the exercise group, participate in local planning efforts, where work, with the schools. Maybe your kids are home from school for the next 2 weeks. Maybe they can do something together with you and with the residents, and everybody can do everything together, not just everybody get on their phone and whenever you're just trying to relax, right? But yeah, interact, get active together, all those things. And again, this is just emphasizing more, physical health, I think, being a role model, choosing healthy foods, cooking together, cooking the healthy foods together, spend time with the family. And just want to say thank you for caring, so that because, and that's why you have to take care of yourselves as well. So just going to open this up to the group for any thoughts or comments. Curious to hear what people are doing. Good. Franklin is looking like he's happy, like he's working on something. So what are you working on that's been good for you yourself, for your own health and your own well-being, to continue being a caregiver? What are you doing?
My clients always have a routine every morning. Just to shower in the morning, eat breakfast, and he likes his stationary bike outside the lanai. And he loves to stay there until lunchtime. We just look outside the plants and all around when the cars passing by. He looks there. Yeah, so
great. Yeah,
that's a routine that he's doing every day. Thank you.
Is that something you could join him with? While he's doing exercise, you can do exercise too.
Yes.
Right? You can turn on the music, you can do it together. Are you exercising? I'll exercise with you. That's a really good way to build it in together.
Yeah, I have different time for my exercises earlier than him. So I can do other kind chore.
Yeah. Anybody else able to do stuff together? Oh, here. I have found that there are cultural stigmas associated with depression that makes them difficult, yes, to self-recognize. That's true. In fact, they probably don't even have the word for it. They don't. it's not something they can speak, but it's important for you to recognize so then you can just do something about it, right? Even if you don't call it depression, you can recognize it and you can try behavioral activation. And what are other ideas? What else are people doing? Do you have people who are residents who are depressed right now?
You know what seems to happen is that when families come to visit other residents, the ones that don't have visitors have a tendency to get depressed.
Mm-hmm.
So yeah, we try not to let them see the other families come. Yeah.
What do people do when that happens?
Well, the way we resolved it now is we actually take them around the side of the house out to the back area, and that's where the families visit so that the rest of the residents can't see them.
It's probably safer too, right? Outdoor visiting, right? Got more space. Watch movie together and talk about the movie and the actor or actresses. Some residents love movies, right? And they can watch the same movie over and over again. Won't get tired of it. What are people doing to take care of themselves during this time?
Sounds like an area we can all improve on, huh?
Yeah. Always make excuses, yeah? I'm too busy to do this. I'm too busy to exercise. I'm too busy. But somehow we gotta make time. Music. Who loves music therapy? Who loves music therapy?
I do.
Yay. A lot of people do. In fact, it's one of the most effective ways, right? Especially if it's interactive, right? Zumba. Who loves Zumba? Raise your hands, right? Yeah, so music oftentimes can get people moving, and then do it with them. Don't just turn it on and walk away, right? Turn it on and join them. Oh, let's see here. We have go to a library, borrow a lot of books, even only the pictures. Oh yeah, that's true. Sometimes just the pictures are great. I love the library. It's free and there's just so much variety. Okay, play soothing instrumental music in the care home. Especially if they love it. Swimming in outdoor pool. Oh, who has a pool? So lucky. That's great.
No, I just go to the Y.
Oh, okay. Okay. Anybody? Oh, cooking or baking. That's right. There are some people who love to cook and bake, right? And this is especially a time when they need their help, right? So I need help. I can't do this by myself. Help me. And I'm sure they will have plenty ideas for you. Baking, exercise, light weights. Ah, right. Focusing on self-care, right? The caregivers work so hard for sure. Joining resident with virtual church. Yeah. The church is kind of lonely. It's virtual and you have nobody to share it with, right? It's good to share it together. So maybe there are ways you can do self-care together with the residents. Oh, yeah. This one is a good one. Playing the client's favorite song and singing with them. Have you noticed that when you sing along, you cheer up faster than when you just listen? Yeah. Anybody ever have residents who say no to everything you suggest? What do you do? What did you try? What did you try?
I think exploring their interests, you know, things that they like to do, just trying to get them out of that mundane, you know, everyday routine kind of thing and just try something new.
Igan tinawagan na ni Madi Silverman, the Department of Human Services.
Okay, giving
Maribel, do you
voices.
Caregiver named Gemma Bautista? No, but I know her. She's
Oh,
with
you
Karina.
need to mute Maribel. Okay. Shopping around and eating out. Oh, yes, there are people who love to shop. Yeah. Window shopping is a good thing, right? Even if you don't have money, even window shopping is good, right? Ah,
I just think getting out, period, different
yes.
environment,
Mhm.
a different atmosphere as a whole
That's
can
right.
cheer anyone up.
Mhm. So are your caregivers encouraged to go out? Do they have time to go out?
You know, sometimes even if you have at a doctor's appointment and
Mhm.
there's a McDonald's or a Burger King right nearby,
Great. Yes.
no, it's something different.
Yes. Absolutely.
I
Go
do
out
take
and you say, oh, let's get an ice cream while we're here, right? Go ahead.
On my side, I do take my clients every twice in a month. But since the pandemic was being rampant, we're still doing it by staying in the car. I'm just gonna make them unwind outside, and then I noticed that it's been helping them and like their mind, that they're not gonna be in the room for looking on the four circles of their room. So from there, I've been doing that like as obligation for them. So they really like it. One of my clients, they always say, no, 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 I'm not like that person. I don't want to go out. I'm not going to be unwind. I'm okay. You can just take up two of them and then I'm going to be outside. But once the day that we took her out, she always waiting for every 15 and 30 of the month. She's so excited for us to take them out. So yeah, it's just like I wanted to share that uh going out with them, and then not necessarily take them in the mall or take them in the crowded places. I do like a park that they can just know, not people as much in there, just to have something to see different from your house. It makes them different.
You are right. You are right. That is a great idea. You know, my auntie, she's like 90 years old and she's too tired if she goes out. It makes her too tired. You know, it's too much. But she will stay in the car. You know, She stays in the car and says hi to people or sees different scenery. Huge difference. She looks forward to it. And so, yeah, you're saying, say, other people do that? Go on these drive-bys? Very safe. Great ideas. Any other good ideas? Taking care of yourself and your clients at the same time. Yeah, so John, I put into the chat box for your certificates. There's a link, so you just click on the link and you can make sure you get your certificate. So don't forget to do that before we end. Okay. Anybody else have things they want to share to encourage each other? What to do? More ideas? So next time we're going to talk a little bit. We're going to do something similar to today, talking again about things to do with people who are really depressed, talk about behavioral activation, but we're going to do more sharing and talk about some challenging maybe situations. So please come ready to share some of your challenging cases. That way we can kind of inspire each other and help each other out. And then, yeah, then also by then we'll have been past the holidays and you can share some of the fun things that the residents were able to do for the holidays. That will be good too. Okay. Anybody else want to share? Are there things that happened this week that made your residents laugh? Or did something that got them out of their room, out of their shell when they didn't want to come out? Okay. Having a haircut, isn't that amazing? Haircuts make you feel beautiful, huh? Good idea. Make sure everybody gets one before the holidays, right? Including yourself, who hasn't got a haircut yet this month. Time to get a haircut. Oh, massage and a spa day.
That sounds like a great idea.
It does. It does.
Where do we
Right?
sign up?
Get your nails done.
Mhm.
Great. All right. Well, anyway, I hope you guys do something extra special for yourselves this next couple of weeks. Take extra care of yourselves. You know, build in self-care along with resident care. And then look out for each other. Take care of each other. Right. And just really thank you very much. And we appreciate everything you guys are doing. Okay, thank you so much for joining. Don't forget to click on the link and get your certificates. Okay, see you next month. And I hope you have a wonderful holiday, wonderful Christmas, wonderful New Year's. Make some good resolutions to take care of yourself. All right.
Mele kaliki makaholi makahiki ho ahui ho.
Ahui ho.
Happy holidays.
Ahoy ho.
Bye.
Happy holidays.
Yeah, Merry Christmas, Happy Holidays, Happy New Year.
God bless us all.
Now we have to just turn on the holiday music and start to dance. I hear somebody else has holiday music. Wonderful. Okay, bye.